Dr. Walensky, the CDC school reopening guidance has been at odds with what many public health experts are recommending. When we discussed this issue recently, I really detected a lack of a sense of urgency on your part to reopen schools. Let me just share a little bit with everyone here what the public health experts are saying. In USA Today, 4 prominent experts said, the recent school reopening guidance released by CDC is an example of fears influencing and resulting in misinterpretation of science and harmful policy. The American Academy of Pediatricians cautioned against strict adherence to 6 feet of distancing if that forces students into remote learning. And Dr. Jha, who testified before us just last week, said in an interview that the guidance, quote, didn't feel to most of us in the public health world as particularly well-grounded in evidence and science. Maine's own CDC director made the point to me that children are less likely to contract COVID in schools than they are in other settings. Dr. Jha also said that we were focusing on the wrong things. We should be focusing on mask wearing, ventilation, and he said, I did not mention 3 feet versus 6 feet. I did not mention deep cleaning of surfaces. There's a lot that's going on that's gotten us distracted. We can keep teachers safe. We can keep kids safe. We can open schools, and we have the ability to do that now. In the meantime, the negative effects on our children continue to grow. And I'm not just talking about the lost learning. I'm talking about social development. I'm talking about behavioral problems, stress on the children, on their parents. A hospital administrator in Maine told me just yesterday that they're having children dropped off at the emergency room with behavioral problems, and the grandparents or the parent who brought them just driving away, just leaving them there. We have got to get the schools reopened, and you've presented no timeline at all for doing that, and the CDC recommendations, particularly on physical distancing of at least 6 feet, are just not in sync with what most public health experts are recommending. So I'd like to know what you're going to do and when to get our schools reopened.
Thank you for that question. Thank you for the conversation we had, and I'm very sorry it appeared like it wasn't urgent to me. I'm the mother of 3, one of whom has been home for this entire year. This is an urgent issue. I understand the mental health challenges. I understand the educational challenge, this food insecurity. This is urgent. Please don't get me wrong. This is urgent. There was a study out of Wisconsin that demonstrated in schools that in a time of high disease prevalence, that with 92% mask wearing and de-densification of classrooms, somewhere between 11 and 20 students, we could get students back to school safely. There's also a similar study from Georgia that showed without masking and without the proper mitigation strategies, there were outbreaks in 9 elementary schools. So our guidance was intended to lean in. We specifically articulated as it was released that schools that were doing well, we wanted to, and were open, we wanted to keep open. And so as we released this guidance several weeks ago, it was intended for schools to lean in, for schools that were clammed shut, to use this guidance to decide what mitigation strategies they needed to do, recognizing that the MMWR that we reported several weeks ago, 60% of students were wearing masks in classrooms. We needed to get those numbers up if this was going to be done safely, and this was the roadmap to do so. On the question of 3 feet and 6 feet, We looked for science to determine what was the proper distance on the question of 3 feet and 6 feet. At the time, you may recall, there were about 250,000 cases per day, and much of our communities were in a very high rates of community spread. We agree on the science that the spread was happening less so in the schools than in the community, but if mask wearing was happening, we were seeing breakouts, and we had science for that. Just last Thursday, I believe, there was a study out of CID from Massachusetts in a place where there was about 100% mask wearing, that 3 feet and 6 feet yielded the same amount of infections, and so that was the first study we had seen that looked at 3 feet versus 6 feet. Indeed, because 6 feet has been such a challenge, science has leaned in, and there are now emerging studies on the question between 3 feet and 6 feet. I'm aware of several that will be released in the next several days, and we are actively looking at our guidance to update it to address that science. Thank you.
You need to do it now. And I agree with you on mask wearing, but I really wish that you would look at this testimony and what these public health experts are saying. Thank you.